reaction on this. I have our friend Dr. Raywat Deonandan, an epidemiologist and science communicator at the University of Ottawa. Welcome back.
Thanks for having me back.
Great to have you on the show. So we've gone from 50 people permitted inside to only 10. It's a big drop. What do you think of it?
It's a good start, and it's long overdue, and it might get more intense than that in the coming weeks.
How intense do you think it needs to get?
Well, I've heard some people say that 6 is the right number. I'm not sure where that number comes from, but it's the issue with the announcement is that it's regional, and a regional approach is good, focusing on Peel and Toronto and Ottawa, but nothing prevents someone from Toronto to going to a party in Hamilton and coming back, right? So it's a good start, but I anticipate we may see this unroll further across the province.
I wonder if they're talking about 6 because of the UK. In the UK, they've implemented the rule of 6 now. They're trying to simplify and strengthen the rules. Maybe that's where it comes from?
It could be. It could be an imperial versus metric thing. Who knows?
So do you actually think this is going to make a big difference? Do you think that going from 50 to 10, we'll see a drop in the numbers?
Oh, yes, absolutely. This is the right thing to do. It's these indoor parties that's driving a big chunk of these cases, and, of course, restaurants and bars as well. And I like the fact that they're targeting the people hosting the parties because they are deliberately provoking an epidemic. They know what they're doing, right? And so that's such a profoundly irresponsible thing to do that it demands a criminal response like this.
Today in the legislature, NDP leader Andrea Horwath was going after the premier. I want to play the clip here that she said to him because she was taking issue not with capping social gatherings, but she was taking issue with the fact that it's different than the number of kids that are in schools. Here she is saying it doesn't make sense to do this in private homes if you're not doing it in schools as well.
For months, the Premier has been insisting that having students crammed into classrooms by the dozens, up to 30 kids in a classroom, is perfectly safe. Now in Ottawa, Peel, and Toronto, the government's suggesting that that's not safe, that people need to be restricted to only 10 in an indoor space. How can he possibly then justify continuing to allow in Peel, Ottawa, and Toronto, and other locations more than 10 children in a school classroom?
Premier Doug Ford responded today at his news conference. He was asked about that, and he said, no, it's not a fair comparison.
We're comparing apples and oranges here. We're comparing a school that have cohorts and have the teachers there supervising and have social distancing and wearing masks and hand sanitizer and having nurses on hand and comparing it to a wild party in the backyard that people are drinking, hugging, kissing, spitting, every other thing that you'd possibly think of, not paying attention to the rules, spreading COVID. It's unacceptable, and it's just apples and oranges.
Okay, so I don't know what a drinking, hugging, kissing, spitting party is. Usually only 3 of those things exist at my parties, and spitting is not one of them. Somebody's definitely going to put that on a T-shirt, by the way. But is it fair, in your professional opinion, to compare social gathering limits to school class sizes?
Yes and no. How's that for an equivocal answer? They are comparable and they're not comparable, so they're both right. The Premier is right that, yes, schools are a bit different in that we have deployed public health measures to attempt to keep the situation safe. But Horwath is right, too, in that the school classes should be smaller. Right, and so there is an inconsistency in messaging here that should be addressed. And I'd like to see, in addition, closing bars and reducing the capacity of restaurants, closing casinos, possibly even museums. So we need a full court press on the containment of socialization of any opportunity for transmission. And that's not just in the home, that's in businesses and in schools as well, because we're heading into dangerous territory.
But you know that there's going to be people pushing back on that, Doctor, saying, well, there's no established link in Ottawa to bars, so why punish business owners when they haven't done anything?
I understand that, and the business owners, for the most part, are doing everything right. It's not their fault the disease seems to find ways to transcend our restrictions. But around the world, we're seeing transmission being accelerated by bars. So maybe don't play around with potential explosive situations until we know what the situation is. Maybe close some things now and wait a couple of weeks to see if, in fact, we have an out-of-control epidemic that's bleeding into the hospital numbers and the death numbers. I think having too many things open at the same time, in addition to schools, as the case numbers are growing, is probably an irresponsible tack.
Safe to say that hugging, kissing, and spitting probably aren't the best things to be doing at your social gatherings, even if you do only have 10 people that are inside. But in all seriousness, the hugging part of that, hasn't it now been shown that hugging is not actually as bad as we previously thought, because you're embracing someone and you're turning your head away from them?
Right. So there are three ways to get this disease, three main ways. One is droplet transmission that you get from breathing on each other and talking against each other. And the second is aerosol transmission that you get from spouting viral particles into the air. And the third is by touching. And it's that touching part that hugging comes into play. And really, it doesn't seem to happen. So you're right in that respect. However, the aerosol component is probably more important than we gave it credit for. So if you're in an enclosed environment and you're hugging, you're still breathing the same air, and if you're there for a long period of time, the chances of transmission increase. So it's not the hugging as much as it is being in the same room close by.
Dr. Raywat Deonandan is an epidemiologist and science communicator. A lot of people are asking, are we in the second wave? Are we on the precipice of the second wave? Can you orient us here a little bit? Where do you think we are?
Well, the wave terminology is not quite right. What we have is surges and resurgences. It's all based on human behavior. So based upon human behavior, yeah, we're in a resurgence of the disease right now. It is climbing, and it is going to accelerate in that process for the next little while. So I would say, if you're going to use the wave terminology, which I don't like, but I will, yeah, we're probably in the second wave now.
Okay, and why is it that you don't like it? It's not proper scientifically speaking, or you think it might be misleading, and then people think, oh, we're in the second wave and soon it'll be over and then we're done?
Yeah, part of that. So the wave terminology kind of implies that there's something innate to the virus, that it goes in waves, it's seasonal. It isn't. It's entirely dependent on human behavior. It's because we went inside that the first wave ended. It's because we came out again that the second wave begins. And it'll go back down again when we go back inside and do the other responsible public health things. So the wave terminology, again, you're right. It suggests that we just got to wait it out. That's not true. We have to do certain things to diminish the resurgence.
So in the United States, they have been approving these rapid COVID-19 testing devices. And Canada, I think a lot of our citizens are feeling a little bit envious right now. Months after the U.S. has approved some of these, our health minister at the federal level, Patty Hajdu, said that the holdup is the technology. And she was saying that Health Canada just is not satisfied with any of the options that they've been reviewing for these rapid testing devices. Are standards too high, or are these devices really just unproven? What do you think?
It's a combination of both. I know another equivocal answer. So back in the early days with the antibody test, for example, the FDA had a bunch of them rolling around willy-nilly, and that created a lot of chaos in their data because some of them are just crap. And Canada held back.
When you say they're crap, they just don't even work? The responses are wrong? They're not effective?
Anyone can make an antibody test. It's hard to make a good one. And so we get a lot of false negatives and false positives. So we waited a long time to get good ones. And so we have a couple of good antibody tests now. We're going to wait until we have good rapid tests as well. Having said that, there is a problem with the way the Health Canada assesses some technologies. The failure of imagination is sometimes in place. They're thinking about tests as diagnostic tools rather than surveillance tools. So by that I mean a diagnostic tool is what you get in the hospital. You get tested for COVID, and they tell you right away, do you have it, do you not? And so they know how to treat you. A surveillance tool doesn't have to be as good. It can tell you if you need to get a second test, if you need to go to the hospital to have that better test done. And so if it's a surveillance tool, we lower the standard a bit and deploy it differently. And up till now, Health Canada has been slow to recognize that different set of parameters for assessing technologies. But I think they're waking up to that now. And again, it's all about imagination and seeing that things can be used in different ways.
Dr. Deonandan, thank you so much for once again coming on the show. We've had you on so many times, and I'm sure we'll be speaking again soon. I know you got your hands full, so we really appreciate you carving out the time. We do. I mean that genuinely, sincerely. Thank you for spending some time with us and answering these questions. It helps our listeners greatly.
Thank you.
Dr. Raywat Deonandan, epidemiologist and science communicator at the University of Ottawa.